Hey guys, it's Dr. Sam Robbins, and today I'm going to talk about TRT. That's testosterone replacement therapy. Anything and everything you want to know about it. I've got, a ton of information, so I'm going to be looking at my notes. So let's first of all, I'm going to tell you about what is testosterone, basically, how does it get started, what you need to know about it, and why pretty much, honest to God, 95% or more of the doctors who prescribe TRT or you go to TRT clinic are doing it incorrectly. They're overdoing it, underdoing some things, and basically is all leading into tons of side effects, not to mention you're completely getting ripped off. So I've been doing this for a while. I can tell you, again, the benefits of TRT, which a lot of them you know about, but also all the things that TRT is not going to do for you, about the myths, the misconceptions about it. How, you think it's going to fix everything, you're going to turn into awesome physique. That's not going to happen. The wrong times to do TRT, when not to do TRT. Basically also dealing with all the testosterone replacement side effects, such as hair loss, gynecomastia, excess body hair, prostate problems. I think I mentioned pimples, erectile problems. Yes, you're going to have erectile problems. Taking testosterone, again, it's got to be done right. Other problems such as blood sugar, blood pressure, the cholesterol problems, a lot of these things. Some of it will get fixed with TRT, and a lot of it will actually go haywire incorrectly with TRT. Also, your TRT options. What's the best dosages? What's the best format, delivery mechanism? What's the best types? What are the safest options? And so forth. Now, before getting started, you might want to know, why should I even listen to me? My background, I've got a bachelor's in kinesiology, master's in nutrition, but more so as a doctor, my area of expertise or what I studied is basically pharmacology, which is a study of drugs, and endocrinology, which is a study of hormones. So hence testosterone, drugs, and hormones. That's my area of specialty. I'll give you my own personal experience with it, as well as clients and so forth. So again, anything and everything you need to know, all the misconceptions, all the wrong information, this is it. It's taken me a lot of time to put this together. I wasn't even going to do it because I'm like, do people even care about it? But there's so much BS information out there that I needed to just set the information straight. So again, my only goal here is, with my channel, with anything I do, is help you achieve your goals quickly, safely, and efficiently, effectively, and save you time and money, and again, all the problems associated with it. Now, before I get started, everything you hear today is going to be for it's information and for entertainment. That's my legal disclaimer. So don't listen to me. Only listen to what your doctor tells you to do. No one else. They know everything. They're God. Don't listen to me. So let's get started. Well, first of all, what is testosterone? Just a quick glance. Testosterone is a hormone that both men and women have. So keep that in mind. Actually, women have more testosterone than they'd have estrogen. That's, most people think it's the other way around. We all have all the same hormones. So keep that in mind. It's just different degrees. Testosterone for men, it's primarily made in the testicles, the gonads, and as you get older, things don't work as well. Your pituitary, tells us signals to here and this, hypothalamus, blah, blah, blah. Forget all the medical stuff. Basically, as we get older, or different things that you do, different diets, different body fat, all these things make your testosterone go lower because things just aren't working as well. So most of it is all made in the testicles. So that's the difference between men and women. Women, it's through the adrenals. Men, it's primarily all through your testicles. So the next question is, all right, so how do you know if you need testosterone? First of all, that's the big question. A lot of people say, I don't feel this or that, or, basically the first thing you want to do is do a thorough blood test. Now, what I mean thorough is you want to do your testosterone, total and free testosterone, your estradiol levels, your dihydrotestosterone levels. And when you do your testosterone, it should be the sensitive assay, as well as estradiol levels should be sensitive, estradiol being estrogen. But the first thing is their level is going to be on a blood test between 300 to 1,000. And by the way, both men and women, have testosterone. Actually, both of us have all the same hormones. We just have higher levels of testosterone than women, but women actually have more testosterone than they have estrogen. So keep that in mind. Testosterone is pivotal for both men and women, for all the things I'm going to mention a little bit later. So you do a blood test, it's nanograms per deciliter, and here in America, it's testosterone is like between 300 to 1,000. Now, if your levels, or let's say you do a blood test, it's like 330, right? The doctor typically will say, hey, it's still in the range. You're 300, 340, that's your range. You're still in the normal, quote unquote, range. So they may not give you testosterone, right? Or you go to one of these clinics who their only goal is to make money, and they're going to tell you, hey, even if your testosterone's 500, hey, you got to be optimal, bro. You got to be like 900 or 1,000. That's the best way to do it. And then boom, they start, charging you an arm and a leg for all the different things you don't need, right? And you can get a bottle of testosterone, and I mentioned it something like this. I'll dig deeper into this in a minute. And charge you like, 40 or 50 bucks a shot, and you get the whole thing for, 50 bucks. So that's the first thing. You do the blood test, depending on where you go. The most important part is really, first of all, what symptoms are you having? All right. If you say, hey, man, my erections aren't so good, that does not mean you have low T. That might just mean you have maybe high blood pressure. Maybe you have high blood sugar, A1C levels. Maybe your body fat is off. Maybe you're not sleeping enough. There's a lot of things that you first need to improve your levels naturally before you even bother doing that. So it's not just one thing. Hey, my testicles aren't working, or my libido is off, or hey, I'm not as muscular as I used to be. That's a big one. The question is, dude, you're not working out like you used to be. You're not putting in the time and effort. You're not eating enough protein. When you're younger, everything you do works well. When you get older, you got to put in more stuff. However, if you're doing all the right things and you have multitude symptoms, not just one or two, hey, I'm just getting fatter. I'm just getting weaker. I have no energy levels. My libido is shot. I can't get erections. I'm moody. I'm just not happy. I'm not driven. You see where this is going? If you have all these other symptoms, which, by the way, I've got an entire video about the top 20 symptoms that you have if you have low testosterone. So if you have those, which I'll link to after this video, then that's the bigger thing. Because look, I know guys who are like, let's say testosterone levels of between 300 to 1,000, right, that I said, and they're like 400. And I'm like, hey, how do you feel? Like, yeah, pretty good, man. I feel good. This, good. Libido, yeah, pretty good. I'm not 20 years old, but this, all of those reasons, you do not need testosterone. Trust me, I'll tell you all the reasons why. It's going to make your life a living hell afterwards. It's something that once you start, you're probably never going to stop, and you can't stop. And I'll give you my own personal reasons behind that, my own personal experience in a little bit. So keep that in mind. Once you start, you're not going to want it. So I want you to start it only if it's your last resort. Keep that in mind. All drugs are used as a last resort, not as option one or maybe option two. Last options. I'm not here to make money off of you on giving you this testosterone and then, hey, afterwards you need Cialis and Viagra and HCG, and maybe I'll give you some hormone replacement therapy and give you some growth hormone and different peptides. And next, you're walking out spending $500 a month. That's bull, all right? This isn't a clinic where I'm going to make thousands of dollars off of you. Just giving you all the experience because I don't want you to fail and get your ass handed to you and lose money and lose your health in the process, because these clinics are making thousands and thousands of dollars, including prescribing you anabolics such as oxandrolone, Anavar, or Winstrol, or Decadurabolin, and all these different things. So let's get that straight right now. How do you need it? Have the symptoms, and if you have blood tests, right? So if it's on the lower end, then that works. Now, let me give you my own personal experience with all of this. I was 19 years old, and I said, all right, doc, I want to do a blood test. I want all my hormones. And this guy said to me, why? I said, I just want to do it. Now, mind you, this is about over 30 years ago. I just aged myself. This is about 30 years ago. So back then it was easier to do all this stuff. It's not so difficult as it is now. So I said, all right, I'm like, I want the following test. I'd done my research. Again, this is where I was passionate about. And guess what? My testosterone was normal. DHT, which is the hair loss, dihydrotestosterone, normal. Estrogen, normal. However, and listen carefully, testosterone was like at 380, right? My dihydrotestosterone level, so it was 380. So it's, remember, 300 is the lower, 1,000 is the high end. Mine was like 380. So I'm like, oh, this sucks. My DHT, the hair loss hormone, was, let's say it was like 20 to 80. I don't remember back then on that original thing. Mine was like 78. It was like at the very high end, normal. My estrogen level, again, was at the very high end, normal. This guy's like, yeah, everything's normal. I'm like, dude, this might be normal, but it's not optimal. It's not just one hormone's out of whack. It's both of my hormones. All three of them are out of whack. Testosterone is low normal. Estrogen is high normal. DHT is high normal. And those two other hormones, DHT and estrogen, they're like an expense for your business, right? So testosterone is your income, and DHT and estrogen, they're expenses. And we care about is to optimize the profit. So I'm like, hey, I need to lower these two other hormones and increase my testosterone. He's like, no, this is normal. Mind you, at this time, my libido and everything was normal. So I didn't start hormones or anything. So at that time, I started taking different herbs and supplements and all these different things to lower my estrogen to a normal lower end, to lower my DHT so it's normal and still in the lower end. Guess what? A year later, I did the blood test. My DHT was low normal, again, in the low but lower normal. Estrogen was in the normal but lower end, and my testosterone went from 380 to 960. So I almost tripled my testosterone. No TRT, no this, no that, none of that stuff. All because I optimized it with different supplements. I remember taking zinc. I took, Avena sativa, all these different things, I'll tell you about later. And I improved some diet things. I improved my fat content, had more eggs and so forth. That's in 1 year. I tripled my testosterone, and I looked better and I felt better. Now, I was young, so I didn't want to be like, oh man, I feel awesome. I felt good as it was. I'm 19, you can't F up too much. But things were better now, and I kept it there for many, many years. So this is a very important topic about having to test your levels and do them all. Don't just do your testosterone. Do all the hormones that I mentioned in previous videos. So as far as what will testosterone do for you, whether you take TRT or just when you have optimal testosterone levels, I think you guys already know it's good for your sex drive, good for libido, good for erections, obviously all the things you care about, good for muscle and strength, good for mood. It'll decrease fat, all these different options, right? These are all the positives. Now, as we get older, things get worse, but a lot of times things get worse because your lifestyle sucks. You're no longer doing anything outside. Your vitamin D sucks. You're not getting any sun like when you're younger. Your sleep sucks because you have so much stress with work and kids and wife and all that kind of stuff. Your diet is not good anymore. You're not exercising. You're not doing all those things that you need to be doing, and even more so because now you're older, all right? Because your body is not longer, even if you had normal levels, they're not as responsive as they used to be. So this is another factor. Now, what will testosterone not do for you? Taking TRT or anything, replacement therapy, not TRT sports theory, dosages. Testosterone is going to make you jacked. All right. It's not going to turn into Arnold. You're not going to all of a sudden gain 20 pounds of muscle. All right. Especially if you're not working out. It's not going to give you the sex drive of a teenager like you used to be. You're not going to walk around with erections all the time. It's not going to fix all these other health issues like sleep and all your blood tests and all that stuff. It's not like this one thing that's going to fix everything, unlike what everyone is promoting to you, all these TRT, HRT clinics that we can fix you. You can't fix something because you're older, all right? You can't all of a sudden make yourself young again just because you added a couple hormones. So keep that in mind. Now, earlier I mentioned all the issues. So who should not take testosterone replacement therapy? Well, first of all, if you don't have any of the symptoms, you can't be like, hey, my sex drive is pretty good. That's good. But you can't be like, hey, my sex drive isn't like I was 20 years old or a teenager. Trust me when I tell you, your sex drive and libido and erections will never, ever be like a teenager, ever. Because people think it's just hormones. There's dopamine, there's serotonin, there's receptor sensitivity, androgen receptor sensitivity. There's also your mind. You see, remember when you were young, just seeing breasts or vagina did it for you, man, right? It was good. Any little thing did it. When you get older, you're like, been there, done that. Its novelty's worn off. It's not new. So those are a lot of the reasons that you're not interested in sex, or you've been with the same partner, or you're like, been there, done that. So these are a lot of the reasons that sex drive is never going to be like it was at the beginning. So keep that in mind. If you want to have kids, not a good idea to take testosterone replacement therapy, even if you take drugs like HCG, which I'll talk about a little bit later. It's not going to do anything for that. It's not going to, you have to take HCG, HMG. There's a lot of things you need to do that once you shut down your testicles, yes, you can still have babies. And many times that baby ends up being a girl. Bodybuilders have it. But most of the time, generally speaking, for most of you, being able to have kids is gone, because once you take in exogenous from the outside, once you take in exogenous testosterone, it shuts down your own. That's why you want to increase it internally, endogenously, not exogenously from the outside. Once you increase it internally, endogenously, everything is good. But when you increase your testosterone from the outside, it tells your testicles and hypothalamus and pituitary, hey, we're getting all this stuff from the outside. Shut down. We don't need to produce anymore. What does that mean? Your testicles are no longer producing. They're going to start to shrink. Some people, it shrinks like half the size, all right? Some people, like bodybuilders, some of them just literally goes inside the stomach again. It shrinks a lot. That's a genetic thing. But for sure, anyone who takes testosterone replacement therapy will have smaller testicles, which also means your body's shut down completely, which also means you're not producing sperm and all those other things that go along with having babies. If you're worried about hair loss, testosterone exogenously from the outside will accelerate hair loss in everybody. There's no way of getting around it if you're concerned about that. And I'll give you a quick example. I had a friend whose dad was like 72 and his hormones were out of whack. So this was another country. So they gave him testosterone, right? They gave him the ampules of testosterone and anthate. Again, I'll deal with this a little bit later. They gave him testosterone and anthate, and they give him every couple of weeks. And boom, he started losing hair. Mind you, the guy, old dad, he had like a Norwood too. It had like maybe receded a little bit. He still had a lot of hair at age 70. So you think the mother effer is like done, immune to hair loss. Guess what? He started losing a ton of hair in his 70s because it turned on or triggered his hair loss because maybe his hormones went way above normal. And there's other things that happen. There's conversions and things like that. So keep that in mind. Hair loss is a big time. Zits, prostate issues. When I say hair loss, prostate issues can get exacerbated for some guys. Why? Because of the conversions to DHT and estrogen. Again, I'll talk about this in a little bit. Who should, again, not take it? If you're already genetically squishy, soft, hairy, losing hair, hair loss, balding, have some gynecomastia and all that, testosterone will exacerbate all those problems because you're genetically not good. You're genetically converting a lot to estrogen and DHT. So by taking testosterone, it'll naturally convert a lot more. So again, it's like you throwing good money or bad money, good money into something bad. It's not going to go anywhere. It's just going to create more expenses. Remember earlier I said estrogen and DHT is an expense? This is just going to make things worse. So keep that in mind. If you're already prone to these issues, testosterone will make things a lot worse. That's why testosterone is a steroid, and that's why scientists made all these different other versions of steroids to reduce some of those androgen side effects that testosterone has. And there's ways around it, which I'll get to in a minute. Another reason is why you should not take testosterone. If your blood tests are already out of whack, blood pressure, hematocrit, blood sugar levels, cholesterol, testosterone can, and in many people, make things worse. Now, some people actually make things better, but for a lot of people, it can make things worse. Why? Because you're already not good. You're already not having a healthy lifestyle, eating well, exercising, taking the right supplements. That testosterone is going to make things worse. It's not going to fix everything. It's not a magic bullet. And for, again, a lot of people, it gets worse. Now, another problem is they give testosterone to people who even have normal levels. Remember I told you there's that range, 300 to, let's say, 1,000. I know a lot of HRT clinics like, hey, man, you're like at 500, dude. Ideally, you want to be at the higher end. You want to be like 900. But you're still in the normal range, dude. You don't need it. If you have all these symptoms, let's fix your lifestyle and all those things first, then take the testosterone. Because if you're already in a decent normal range, that's fine. Don't add to it. Don't shut down your body, okay? And I'll tell you why in a minute. Remember, when you take testosterone, especially as you get older, testosterone converts more to DHT, 5-alpha reductase. DHT is dihydrotestosterone. Again, that's the hair loss, the body hair, the prostate problems. Another thing that testosterone will convert to is estrogen, estradiol. And what does that mean? It's man boobs, it's gynecomastia, it's body fat, it's moodiness, it's anxiety, all those female problems. You're going to get a lot more of that. So as we get older, what your goal is to reduce those conversions. by taking testosterone, you're not reducing, it's going to exacerbate all those problems. So keep that in mind. As we get older, the body, for whatever reason, starts to produce more 5-alpha reductase and aromatase enzyme. That means that testosterone naturally ends up being here, and it starts to go down while DHT goes up and estrogen goes up. It's like this. So the goal is, by just like I did, remember when I told you I was 19, I lowered my DHT and estrogen together. Boom, those came down and my testosterone tripled. All right. This was 19. I didn't know about all these things that I know now. Things could have been even better. And my levels are always high now, naturally, until I screwed them up many years ago. I'll tell you more about that in a minute. Now, before I get into all the different types of testosterone, another side effects that you need to keep in mind before you start is this is a lifelong commitment. Okay. You're doing injections for the most part. Some people do pellets, but once you start, it's not something you can stop. All right. When you travel, you got to bring this stuff with you. You're constantly injecting yourself. It's not fun. All right. There's topicals. It doesn't work as well. I'll tell you all about that in a minute. So once you start, again, you got to take this. It's a lifelong commitment. Keep that in mind. If you get tired, at the beginning, you're like, awesome, I'm going to take an injection. I'm going to look and feel awesome. But what happens is after a year or 2 or 3 or 5, you're going to be like, F me, man. I got to keep taking these injections all the time. And because you're doing it at these clinics, they're going to keep charging you, getting ripped off. So keep that in mind. Again, shut down the testicles, like I mentioned. They're going to shrink. Your sperm, all of that, the ejaculation volume, it's all going to go down. It's not going to come back up, all right? The other problem, like I said, testicular shrinkage is not cool. Maybe women don't care if your testicles shrink half the size or even more, but a guy does in some ways care. You want that entire area, penis and balls, as big as possible. Mood swings. Taking testosterone is going to create mood swings. Sometimes aggression, sometimes moodiness, sometimes depression, anxiety. Energy levels are going to go up and down. Your sex drive is going to go up and down. And yes, you can cause erectile problems taking testosterone. Sleep can be bad. I know my friend, he was taking testosterone. He's like, I increased it just a little bit, man. I have insomnia all the time. Depends on how sensitive you are. And again, I told you about the physical side effects. Hair loss, if it's going to get there. Prostate problems eventually, and when you do it incorrectly, not balancing all the other hormones, the body hair, the acne, the gynecomastia, zits, all that different things, those will get side effects, will get worse. All right, so now let's talk about all the different forms of testosterone. If you decide to go through with all this, again, increase your testosterone levels naturally as much as you can. I've got videos about this, and I got a free email course about this. The best diet, the best exercises, the best herbs and vitamins and minerals, all these things that you should do first. All this information is below for free. You can take a look. However, if you decide you're going to take them, all right, obviously your goal is hopefully you'll find a good doctor, a good clinic. They're not saying they rip you off, but let's talk about it. First of all, there's injection, all right? So the injection is you get like a bottle like this, all right? This is like basically testosterone cypionate. That's in the US. This is like 200 milligrams. This one's 100 milligram one. This is a different form of testosterone. Again, enanthate, just a different company. These come in multi-use vials. So this is like technically 10 to maybe 20 shots. Now in Europe and other places, they give you ampules, single-use ampules, right? So that's what you get in other countries. And this one's testosterone enanthate, not cypionate. So in America, it's cypionate. And in other countries, it's enanthate. This is like 250 milligrams. This one's 200 milligrams. This one's a 100 milligram one. Okay, so it all depends on the dosage. The other thing is you can have basically a topical one. This is a cream you put on every day, sometimes, twice a day. The problem with the cream is it's not going to get absorbed as well. And depending on where you put it on the skin, for example, if you put it on the testicles, it increases DHT more. If you put it different body parts, you want to basically put it somewhere where it's like your body is leaner here, like on the inside of your skin or forearm or chest, that area, but it's somewhere where it's thick, it's not going to work as well. All these factors. There's also the pellets. The pellets you have to put in there, and it's 6 months to 3 months, and then the pellet slowly releases the testosterone. The benefit of that is, hey, set it and forget it. The problem with that is you can't adjust it. It can be too much or too little, and now you're stuck with it. They can't just like remove the pellets, all right? They inject it into your upper ass and like they do with a gun on a cow. So again, my suggestion is you just take the injections. Now, how do you do the injections? Again, I'm not here to tell you what to do. You basically will, inject it with like a big syringe, but basically you would take out a little bit and inject it. Typically in the old days, they would do like once a week. Keep something in mind. Your body typically produces about up to 10 milligrams of testosterone a day. 10 milligrams a day, 10 times 7 days, that's 70 milligrams. When you take a testosterone cypionate, for example, at 100 milligrams a week, which is the prescribed dose, because of the ester on the cypionate, that 100 milligrams, basically 70% of it gets released, hence 70 milligrams out of the 100 gets used, hence 70 milligrams a week. That's how they came up with it. So if your body's making 70 milligrams a week, you take 100 milligrams as test cypionate, the 30 doesn't get used because of the ester weight. So basically that's 70 milligrams, 170 milligrams, blah, blah, blah. Now, in the old days, they would do it once a week, or they would do the 200 milligrams and they do it once every 2 weeks and so forth. That gets released over time. It's not good because you're going to go up, then it's going to come down, it's going to plateau, then it's going to go below. So you have to, for a couple of days, and you're like, not bad. Then you crash, and you're like, oh, life sucks, this and that. So the ideal way is you would inject more frequently at smaller dosages. In that situation, instead of using, for example, a big syringe like this one and do it once a week, like in your butt or something like that, you take a little syringe. This is basically an insulin needle. This is 100 units, which is the equivalent of 1 ml. So I'm not going to get in all the dosages right now. If you want, let me know in the comment section. I can talk about all this stuff. And most likely I'm going to create a membership site for this stuff because I can't freely talk about any of this stuff on YouTube or any platform. It's got to be hidden. It's got to be membership paid. So there's a lot of things I can tell you. I've dealt with pro bodybuilders since the mid 90s, dealt with Dan Duchesne and all these different guys in the old days. So you would just take these and you would inject it, in the muscle a little bit at a time, just a little bit. And you'd inject it like every day or every other day or maybe 3 times a week, just a little bit, right? So you're quote unquote micro dosing it. So you do it a little bit, or if you want to keep it, you do it sub-Q. So intramuscular is in the muscle. You would instead do sub-Q, subcutaneous. That means you just take a little bit of your fat, belly fat, your love handles, your outside of your ass, that area, and you just inject it. The needle's tiny, dude. It's like super small. You probably can't even see it. Versus this motherfucker, dude. This is like ginormous, okay? So by using that little baby dose, that little baby needle, the insulin needle, you would just inject it like 3 times a week, Monday, Wednesday, Friday. It keeps your blood levels regular, which is good for your estrogen levels, DHT, mood, sex drive. So that's the main thing. If you're going to do it, you want to keep it regular. You don't want the highs and lows. You don't want all the fluctuations. So you would basically, again, if you're going to do 100 milligrams a week, right, you would do something like 20 milligrams 5 days a week, something like that. Or if you don't want to inject 5 days a week, you might do like 33 milligrams 3 times a week, right? Remember, the 100 milligrams, because of the ester weight, it really gets you 70 milligrams, and that becomes your dose. A lot of these clinics will just fucking up you to like 200 milligrams right away, right? Now, keep something in mind. When you first take testosterone, you're going to feel awesome. Yeah. You're going to feel like you rule the world. You're like awesome all the time. Why? Because you have your testosterone that you're normally making, and then you're adding on top of it. So you're awesome, and your testicles are working. Everything is good. But right around within a week or two, your body's like, hey, man, what's going on? We don't need all this extra stuff in the house, right? So they're going to, at that point, shut your testicles down. So now, all of a sudden, your natural, let's say 300, plus the additional that you're taking is going to start to go down. And all of a sudden, you're like, hey, man, I don't really feel this stuff anymore, right? And that's because your body got used to it. It lowered its own. So now this is when the doctor's like, we're going to up the dose because I want you to feel awesome again. You're never going to. Every time you do it, things shut down in the body. Remember, your body wants homeostasis. Homeostasis means it just wants things to be regular. doesn't like highs and lows, doesn't like anything out of the range. So that's why I said you got to take the shots like 3-4 times a week, a little bit, because that keeps fluctuations, preventing them, thus reducing all the potential side effects. That's the problem. Now, years ago, I did this stuff. I felt awesome, and then I would just keep upping the dose. I just got bloated. I got all this stuff. In fact, as I look at this video, this thing's already getting super long because I've got other things. So if you want for me to talk about my own personal uses, experiences, and so forth with testosterone and other things, let me know below in the comment section. So let's just say you take the testosterone. And again, remember, testosterone is going to convert to other hormones, DHT and estrogen. So a doctor will typically try to block those hormones. The first one is they'll want to block your estrogen levels or lower them with an aromatase inhibitor. Remember, the aromatase is the enzyme that takes testosterone and converts it to estrogen. Aromatase is an enzyme. ACE is an enzyme. OS is sugar. Lactose is sugar in milk. Lactase is the enzyme that digests the lactose. So what will they do? They will give you something called Arimidex. Okay. They'll give you a generic form of that one, right? Depending on the dose, they'll give it. So this is anastrozole, right? They can give you something they probably won't, something that's a lot stronger, which is something like Femara. That's, again, way strong. They also will give you exemestane, Aromacin. That one is actually better. I had the bottle, I forgot to bring it. So Aromacin is the one I would suggest. But nevertheless, they're going to end up giving you Arimidex to reduce the estrogen. Estrogen has a lot of benefits. I know I just said everything's bad. Estrogen is good for sex drive. Estrogen is good for your heart. Estrogen is good for blood flow. It's actually good for building muscle. It's good for IGF and growth hormone levels. Estrogen is good for your hair. All these things. As long as it's in a normal range, I suggest lower normal. Problems become when it's normal and high or above high. When they give you these drugs, testosterone, they give you the Arimidex and nasal, it will typically lower it a little bit too much. So keep that in mind, right? And they have to figure all that stuff out. So that's the estrogen they're going to do. For a lot of people, again, joint pains, also if they took too much. If you lower your estrogen too much, also you're completely going to be impotent. So keep that in mind. It's not good. You're fatigued. You feel like crap. Low estrogen in some ways is really bad, and so is high estrogen. You want to keep it in the normal. I suggest low normal. Now, there's also the DHT side effects, DHT, dihydrotestosterone. With that remember, that has to do with the hair loss, the prostate issues, the body hair, and so forth. For that, they give you something called Propecia. Now, this is a generic version of Propecia. I don't know if you can see it. It's just a little tablet. There's one that's a lot stronger. It's called Avodart. So this is both type 1 and type 2. Most of the time, they'll just give you Propecia at like 1 milligram a day, which is good. It does help reduce some of those hair issue side effects. But for some people, it literally will make them impotent. So if you're going to take the Propecia, one reason is as Propecia, you take it, the DHT comes down, testosterone goes up, which is cool, but now you have more testosterone converting to more estrogen. So now ideally you have to almost lower both DHT and estrogen to normal levels if you're going to be taking testosterone. All right. Remember, those are two expenses you don't want. You want to keep them normal, but low normal, testosterone normal, but high normal. So that's the thing. Now, remember earlier I said if your balls, your testicles shut down, what they do is they give you HCG, which is damn hard to get these days. And that basically tells your body, hey, to produce more LH, FSH, to keep producing your testicles. That prevents them from shrinking, even though they will shrink. And there's other benefits that your testicles will make. Your testicles, I said, make testosterone, but it makes other hormones too. Lots of other, awesome little hormones. So I always suggest people take testosterone with HCG and inhibitors. And now you're like, shit, dude. And by the way, HCG is an injection. You reconstitute it with water. You reconstitute it with water and you inject that sub-Q. You do that maybe 3 times a week and you just do that every week. Or you can go, for like 1 month off, two weeks off or something like that. But again, you end up taking it pretty much all the time, congruently with the testosterone to keep everything working. And that's the main thing to do, is keep your testicles from working, to keep them working. So if you decide you want to have kids, maybe your testicles didn't completely shut down for months on end, they're still kind of alive, and it's easier to keep them going afterwards. Boy, that's a lot. I haven't even gotten to the other stuff yet, the cool stuff. So right now, as I said, this is a lot to handle. First and foremost, underneath the video, I've told you all the different ways you first need to improve your testosterone levels naturally, okay? Best herbs, I got an entire email course about it. Again, it's free. You have to do that, because when you do that, then taking testosterone becomes even better, easier. Then taking testosterone will work better at a much lower dose. First, fix it, and most likely, I swear to you, I've had hundreds, if not thousands of clients over the past few decades that I've told them fix things naturally, and they're better off with it, okay? There's always time. Once you fix things naturally as much as you can, then maybe you postpone taking TRT for another 5, 10, 15, 20 years. I had a guy who wanted to take him in his 30s. I said, don't. He waited. I told him all the things to do naturally. And at 55, he's still very good. Okay. Again, I can do consultations for all these different things. Just whatever you have questions, let me know below in the comment section. And again, take a look at all the stuff in the description. It's all for free on how to improve things naturally. And again, I'll make additional videos on all this stuff. I know this was a lot to go through. You know, this was at least 30, 35 minutes. My goal was 10. And it came out long because I want you to get all the details without getting ripped off, without getting hurt. Because I told you, this is a lifelong commitment. You can't just start and stop. It's not like a vitamin pill that you're like, all right, well, you know, I'm not really feeling it anymore. I don't like taking this stuff. And you stop. When it happens naturally, it's okay. No big deal. There's no side effects. But when you have to take something exogenously, a drug, there's always negative side effects with drugs. There's always a negative rebound. And trust me, when guys go off testosterone, they feel like utter shit. Okay? Complete shutdown, dude. Your life with low testosterone may suck. When you get off, you almost have no testosterone, and that suckiness becomes 10 times worse. You might even become suicidal. So just keep that in mind. Do it naturally. Let me know the questions. If this was helpful, subscribe. All right. I've always tell people subscribe. You're going to miss out on additional great information about future videos similar to this. And you know what? Share it with other people. Post it on other social media so people get the total facts. Again, I've been doing this for a long time. I rarely talk about this stuff because I deal with private clients. I deal with professional athletes. I deal with a lot of bodybuilders and Olympians and so forth. This is what I've been doing most of my life. Okay. That's the part I get excited about. I love hormones. I love body. I love all that stuff, but I always like to fix it first naturally before you add in the drugs. I know I've repeated myself 10 times, but this is important because most of you hear it, but they don't take action on it. You've already made your mind up as a bias. Trust me, learn from my freaking mistakes. Learn from my mistakes. Learn from my mistakes. That's the whole point of me doing this. I don't need to do it for me. I'm doing it for you. So I hope this was helpful. Questions and comments below. Take a look at all the important stuff below in the description area. As always, wishing you a very happy and healthy day.